afternoon. My name is Tim Myers, occupational therapist with Prairie Rehab. I've been here about 9 years, and I work with orthopedics, the shoulder, elbow, and hand. Also perform workstation ergonomic evaluations. So today we're going to talk about ergonomics at the workplace, which can also apply to many people that work from home, trying to help set up their workstations a little bit. I have Morgan here that's going to kind of help me as we go through this. So any comments, questions, you can put in the comment section there, and we'll be glad to answer those later for you. The first thing I want to talk about is the chair. So there are going to be a lot of different chairs out there. You want to find the one that fits you best. But if we're talking about the basics of a chair, if I pull Morgan back here just a little bit, the hips, the torso we want straight, and then the hips will be at 90 degrees, and then also the knee at 90 degrees. So in this position here, technically we would have to have her go up just a little bit like this by using a footrest. Some people need a footrest, some don't. Now it does depend on the height of your desk also, so we might have to make some adjustments. But the ideal placement is to have 90 at the hips and 90 at the knees. Also, most chairs, not all, have a lumbar support system in them. This chair does not, but most of the lumbar support, they're going to have a natural curve, which will be right through here. That's where the lumbar support should fill in to help your posture. A lot of chairs are going to have a lumbar support system that's integrated into the chair, which will be right here, and you'll go up and down. If I turn Morgan, some on the back will be right here that lift up and down. Again, find the position that works best for you, that's most comfortable, that gives you the correct posture. You're trying to fill in that natural curve in your back, so that's where that lumbar support system will go. There are additional lumbar supports that a lot of people have seen that you can buy online or in the store that will strap back here, wrap around, and have a cushion on the front with that. Okay, there are mechanisms, for example, with this backrest, where you can tilt it back or forward, and she's in a pretty good position there. Also, if we look at the arm rest here, there are different adjustments on different chairs. This doesn't have all the adjustments, but I want to kind of explain some to you. Your elbow should be at 90 degrees flexed, so in this position here. That will really help, especially if you have a supported help rest these muscles up here, especially when you're taking breaks to rest your forearm in this trough. Now, unfortunately, this chair is too wide for Morgan's build. It would be a better suit myself having a wider chest. My forearms are out here more. But some chairs, the trough here, the armrest, can go up or down. So we know we want her elbow at 90 degrees, so we know where to put that. Okay? But also some have where the trough here will go in or out like this, which would be beneficial for her. Also, the trough, the armrest, will turn in or turn out like that. Okay? So for her, we would want it to go in. Okay? Now, if we look at the seat pan here, a lot of the seat pans, which is this part here, can adjust and go forward and backwards. You want your butt to be scooted all the way back, and then have about, if I turn you a little bit, about 2 finger width right behind her knee, so you're not compressing against the back of the knee. Okay? The other thing I wanted to kind of point out is if we're looking at casters, which are the wheels on a chair, whatever floor surface you have, say it's a hard floor surface, you want the opposite for your casters. So you want soft. So in this situation, we brought this chair from a different clinic. We're on a hard surface because they have the plastic here and they have hard casters. So we would want soft casters. Now, if this hard plastic wasn't here, we're on the carpet, which is soft, then we would go with a hard caster. Because if you have the hard floor and then the hard casters, the floor can slip out underneath you more easily. Okay? So now, if we look at the monitor, we have her scoot forward. Now again, every desk height is going to be different. This particular one is stationary. But if we look at the monitor height, if she were to put her hands on the keyboard, and scoot up just a little bit, okay? And we'll talk about the position of this in just a minute. The monitor height should be about 20 to 40 inches away, or a good rule of thumb is to say arm lengths away. So once you're in position with your keyboard, Morgan puts her arm out in front of her. The end of the monitor, so I'd have to scoot this back, would be at the end of her fingertips, okay? Thank you. The monitor height, if she's sitting up nice and she's supported, the top of the monitor screen should be eye level with her, which this particular monitor is too low. So some monitors have where they can adjust themselves. Okay, usually they just lift up and down. Or you can get a monitor stand, or you can simply put a few books underneath your monitor to lift it up. The other thing I want to talk about with a monitor is the glare. Some people get headaches, so you want to be careful where you place the monitor in contrast with the lighting system and windows. So that's one thing I just wanted to kind of point out. Anything else on monitors? I think that should be good on that. Let's talk about the keyboard. So with the keyboard, you would want your forearms to be at 90 degrees or slightly below. So from your elbow to your wrist should just be slightly below your elbow, okay? Wrist in a neutral position. Now a lot of people when they're typing, they think that they're in a neutral position, but they're not. Their wrist goes back into extension. So for her, we would have to raise the chair up just a little bit to get her into a better position for that, okay? So the wrist would be in a neutral position like that. Now, once we have her up here, we can make some adjustments to the chair also, so we could be using a footrest to have that better 90-90 with her knees in this chair. So if you look at this again, we talked about that these are going to be too wide for her, so it would be nice to have them in. But again, I like to use these for rest breaks typically, versus so when she is typing, she should, for the most part, be in a neutral position, floating while she's typing. And this is used for a rest break. There are also a lot of people have probably seen the wrist rest that goes across here or on the side. That's used to take for rest breaks also, and not to let your wrist just rest on there throughout your workday with that, okay? Now, if we look at the mouse should be in the same plane as the keyboard. It's the same height with that. There are different mouses depending on what type of work you do. Sometimes people may go from doing a lot of work on a computer, say they work at Citibank or Wells Fargo, and they're talking a lot, typing a little bit, not using the mouse much, to all of a sudden doing a lot of data entry. And so all of a sudden that person might get discomfort in their forearm. Well, their forearm, the muscles in your forearm aren't used to that load of work, and they get fatigued, tired, and painful. So sometimes in that case, having a vertical mouse, so a mouse so this would be a normal mouse flat, a vertical mouse would sit like this, because our natural position with our forearm is to be in this position, not this. So if we're like this, then we're not working against gravity. Using this mouse, we're working against gravity, which is going to be harder for these muscles here. Okay? Okay, so if you read a lot of documents, I would recommend you getting a document holder or a stand. So Morgan was reading a lot of documents down here, so she doesn't have to bend her neck forward constantly going back and forth, where she could hold her head up looking at the monitor and basically just look over with her eyes versus turning her head every time if we had a document holder like this. Okay, so that's another good thing if you're reading a lot of documents looking down at the paper. Other things to think about is positioning of different items. Where's your mouse at in reference to your keyboard? We just talked about that, having that close in the same plane. Also having, if you're using a telephone, to have that close, you're not reaching out too far, doing that repetitively. Most people, I would say now, this day and age, are wearing a headset, or like the iPhones have the AirPods, using that, versus you going like this throughout the day. Now, there are a lot of people that I see that have corner desks. So sometimes we may switch it. So if I back Morgan up here, where I would take the monitor screen here, oops, and I would center it like this, okay? And then, but some people have two screens. So if you have two screens, what you want to do is have them intersect in the middle. So both edges would be here and here, have them intersect in the middle. Unless, that's if you're using them pretty much equally. But if you're using one monitor more than the other, that primary monitor should be moved in a little bit more than the non-primary one, okay? So if we're doing the corner desk, the same principle applies with the arm length away, but one thing that we could get for Morgan in this situation to get her in the right position is an adjustable keyboard tray. So that tray typically will attach underneath the desk, and then the keyboard would be able to slide under here like this. And once she sits down, she would be able to take the keyboard with most, depending on what type you get, and adjust it up, and you can tilt up or down like this, and that would help to put her in the correct position that we talked about before, where the elbow is flexed at 90, and we're keeping that wrist in a neutral position. Because it may be more difficult to have that up here. It just depends person to person and the height of the desk, and also the room that's underneath the desk. We want to make sure that's clear so our knees aren't hitting that at all. Okay, thank you. Let's see, talking about the vertical mouse. Taking breaks is important, especially depending on how much data entry you do, what type of medical history you have, the discomforts, the pains that you're having. A lot of times you want to take maybe a 5-minute break every hour, every 2 hours, doing some stretches. So that is always good to do. There are some certain stretches that I wanted to go over, and one would be lateral flexion. And so that would be just going side to side with your neck, okay? Shoulder blade squeezes, which would be doing this, okay? Good. Neck glide exercises. So if we have that forward head, we're doing a chin tuck, tucking our chin back. Good, like that, okay? Shoulder circles, so we can do one way, so say if we're going forward, and then we can do the opposite way, going back. Cervical neck rotation, turning one way and then the other, so going to the right and to the left, okay? Forearm stretch, now these are just very straightforward, working on your hand like this, and pulling down like this, okay? And working on opening and closing your fisting of your hand. Those are some basic exercises to do. Now, if you have a diagnosis, say carpal tunnel or tennis elbow, we can get more specific on which exercises would work best for you. And if some of these adjustments we just talked about don't help you, you do them for a few weeks and there's no improvement at all in the discomfort that you are having, sometimes that's a good time to go see a therapist to see if there's more that can be done to help you at your workstation. Okay, so I think we covered most things that I wanted to today. We talked about the chair, where the keyboard should be in the same plane as the mouse, the monitor, avoiding the glare. We talked about adjustable keyboard trays underneath there, the lumbar support system, the casters that go down here, Any questions, again, please put them in the comment section, and we will try to answer those as best we can. Thank you.